So today's rapid fire is dedicated for pharmacology PYQs, and there are 15 of those. So let's quickly revise that. You guys can unmute yourself and you can answer it. Okay. So the first one is, what is the mechanism of action of oseltamivir?
Neuroaminidase inhibitor.
So neuroaminidase inhibitor, that means what exactly is it doing? What phase in the cycle of the virus is it acting on?
Inhibiting replicating of virus.
Inhibiting replication?
Release of
Release of virus.
Yes, release of virus.
Yeah,
Sorry.
Release of virus.
or release of the virus. So it is inhibiting the release of the virus. Okay, so remember oseltamivir for influenza. Next one, methotrexate inhibits synthesis of what nucleotide? What nucleotide? TMP, thymidine wala. Because remember, we've discussed in one of the recent sessions where we said that UMP to TMP, thymidylate synthase hota hai, usme wo folate lagta hai, and tetrahydrofolate jo lagega. And you know that the mechanism of action of methotrexate, it acts on what site, what enzyme?
DHFR.
Dihydrofolate reductase.
It inhibits dihydrofolate reductase. So it is preventing the formation of THFR, the THF, which is there, tetrahydrofolate, and that is why the UMP will not get converted to TMP. We had seen this in the context of that deficiency of what vitamin leads to incorporation of uracil in DNA. Remember that? And that is folate deficiency. Because thymidylate synthase to form that TMP, you need that folate.
Folate or B12?
Nice. Particularly, ये जो लगता है ना UMP to TMP, it needs folate, and very specifically methylene tetrahydrofolate, because you know that thymine that contains methyl group. So that methyl, the one carbon carrier wala vitamin, is the folate.
Right?
Indirectly, ये जो methylene tetrahydrofolate है, इसको generate करने के लिए फिर B12 लगता है. So indirectly बोलोगे तो yes, B12 is important for this, but direct अगर पूछा है, so then it is folate. Correct? Agreed?
Okay, ma'am.
Yes. What is that drug which acts on both ACE enzyme and also on NEP, the neutral endopeptidase?
Omapatrolate.
It is omapatrolate. We have discussed this. Sacubitril is only NEP inhibitor. Omapatrolate is both ACE inhibitor, remember, and it is your neutral endopeptidase inhibitor as well. It is both, right? And I think we have discussed this somewhere. That is why it has more risk of.
Yes, cough and angioedema is more.
Correct, because the ACE enzyme and the NEP, both important for bradykinin degradation, it is inhibiting both. So if you see, this will have more risk of cough and angioedema as compared to just ACE inhibitor as well. Okay. Next one, what antihypertensive drug can be used in insulinoma as well? Diazoxide. Okay. Why diazoxide?
Potassium channel opener.
It is ATP sensitive potassium channel, so insulin is released.
Insulin is released, or insulin release is inhibited?
Insulin is not released.
Yeah, correct. So it is a potassium channel blocker or opener?
Opener.
And which are those drugs which are potassium channel blockers? And that is why they release the insulin.
Sulfonylureas.
Correct. Absolutely right. That is sulfonylureas, right? And diazoxide, potassium channel opener. Okay. And the next one, what is the drug of choice for infantile spasms associated with tuberous sclerosis?
Vigabatrin.
Remember tuberous sclerosis, TV. For tuberous sclerosis wala specifically, it is vigabatrin. Otherwise, it is
ACTH.
correct. And what side effect do we have with vigabatrin?
Visual field contraction. Ventricular.
Correct.
Visual contraction.
Remember vigabatrin, visual field contraction, right? And what is the mechanism of action of vigabatrin?
GABA
Transmase inhibitor.
Correct. There's vigabatrin. So it is GABA transaminase inhibitor. The name itself is. Next one, benralizumab. What is the site of action of benralizumab?
interleukin
5 receptor.
Receptor.
Yeah. Please remember it is interleukin 5 receptor inhibitor antagonist. It is not just interleukin 5. Because what acts on interleukin 5 is?
Mepolizumab, distelizumab.
mepolizumab, and
Restizumab.
Benra, remember, is Ra, which is receptor antagonist. Okay, and remember, this is the drug which also causes ADCC dependent. It causes apoptosis also in the cells. It has that additional feature which is there as compared to mepolizumab and restizumab. Okay, and what drug is interleukin 4 inhibitor? Can be used in asthma.
Lizumab.
Dupilumab.
Ipilimumab.
Dupi, right? Dupilumab. It can be used in atopic dermatitis as well. Okay, next one. What drug is used for chemotherapy induced thrombocytopenia? Oprelvecin, which is what interleukin?
11.
Interleukin 11 analog. Remember, oprelvecin, OP is like 0 platelets, and oprelvecin, it has that LVE, that is 11 in its spelling, so it's interleukin 11. Next one, what TB drug can cause optic neuritis?
Ethambutol.
Correct. Remember, ethambutol, E for eye, it causes eye wala side effect. So color blindness, optic neuritis is what it can cause, which is reversible. Next one, mechanism of action of that antimicrobial, which has the side effect of causing tendinopathy, tendon rupture.
Catacoinulan.
Ciprofloxacin.
Correct. Fluoroquinolones, which inhibit DNA gyrase. Remember, A, B, C, D, E, F, G. Fluoroquinolone act on gyrase. So, and fluoroquinolones make the patient fall on the floor because the tendon ruptures. So, tendon rupture, DNA gyrase, fluoroquinolones. Absolutely right. Then you have the next one, which is which hypolipidemic drug causes flushing, hyperglycemia?
Niacin.
Correct. It's niacin. And this flushing is mediated by histamine.
Prostaglandins.
Prostaglandins. That is by prevented by aspirin. And niacin, remember, it's a nice drug. What nice effect does it have? Increases HDL, the healthy lipid, right? But at the same time, it can cause gout. So you do not give in patients with gout. Okay, remember that. Next one, drugs which prevent the ventricular remodeling that happens in heart failure, and that is why they improve the survival.
AC inhibitor,
AC inhibitor, spironolactone, and beta blocker, but not
Digoxin.
digoxin does not improve the survival. Drugs which act on the RAS system and the sympathetic system. So RAS inhibitors and beta blockers. So you have AC inhibitors, spironolactone, which is aldosterone antagonist, and beta blockers. These are the drugs which will prevent the remodeling. Next one, what is the dose of epinephrine in anaphylaxis?
1 into 10,000.
1 into 1,000. And how much ml?
0.5 ml IM.
Correct. 0.5 ml IM, 1 into 1 in
100.
1,000. Remember the mnemonic ACL, 1 in 1,000, 1 in 10,000, 1 in 1 lakh or 2 lakh. Anaphylaxis, cardiac arrest, and with lignocaine. That is local anesthetic. Okay, and remember it's 0.5 ml IM. Next one that you have is, what antiarrhythmic drug causes pulmonary fibrosis?
Amiodarone.
Amiodarone. And what are the other side effects with amiodarone?
Hypothyroidism.
Correct. Thyroid.
Peripheral neuropathy.
Corneal deposition.
Correct. Corneal deposition and blue man syndrome. It gets deposited in the cornea, in the skin, in the lung, right? So blue man syndrome plus pulmonary fibrosis plus amiod has iodine in its like spelling, so it affects the thyroid as well. Okay. So you need to do TFT, PFTs, right, with amiodarone. Next one that you have, phenoldopam is used in what condition?
Heart failure.
Sorry?
It is a D1 agonist to increase the GFR.
Correct.
In oliguria.
Shock with thyroid.
Is it used in heart failure? Is it used in atrial fibrillation? What condition is it used? It is used in hypertensive emergency, right? Even this has been your PYQ. Yeah, specifically this question has come. Phenoldopam is used in. It is used in hypertensive emergency. The mechanism of action, like you rightly mentioned, is D1 agonist, and that's how it causes the afferent dilatation and improves the GFR also.